Welcome all. Welcome to this M Excellence, the final lab. So 1 year almost passed out, and your struggle is coming to an end. So many of you are successful and going to pursue your post-graduation courses in few months from right now. And apart from that, there are very important features regarding the counseling process, the counseling schedule. That is, I feel it's going to help you. The inputs that we are going to share with you is going to be immensely helpful for you in the upcoming the counseling schedule that is going to be take place in the upcoming days. So we are going to pinpoint the important uh, informations which are for sure are going to help you in your upcoming counseling whole process. And many of you are having that luxury to actually go to the various part of the country. So first, the thing is going to start. When the thing is going to start? The thing is going to start on 12th of March as per schedule that have been given, and the first counseling is going to run till 25th of March or 26th of March, and the process is going to be completed on 3rd of April. From today, which is 9th of March, till 3rd of April, almost a month you do have, where at least 10,000 people are going to get their PG seats through All India Counseling. Might be some few more, but this is the first round of counseling, and then after we'll have a second round of counseling. Now, second round of counseling, what is important in between the first round and second round, it is expected there will be a first round of state counseling. It is a very important thing. It is expected, but with my little experiences for last few years, we can understand this actually doesn't take place like that way. So many of the states are going to have their first counseling, but many of the states won't have their first round of counseling, and that is where all the problem starts from. Number two, there will be start of the second round of counseling from the 7th April, which is going to be finished around 22nd April. So it is a 15 days process. So after that, whatever seats are going to be left, those seats are going to be back in the state quota. This is important facet because this is going to decide a whole lot of changes, because different state, the states which are not provided the best of the ranks, will get a clinical seats or very precious seats at much lower rank than those states where the results are very good. So that is one discrepancy that we have to live with, because ideally there should have been a mop-up round, but that doesn't take place, not even this year. Now, after the second round, it is expected to have a second round of state counseling also, and then after the mop-up round is going to take place. So first round All India, then first round of the state counseling, which is ideally have to supposed to take place, and then after there will be a mop-up round, and in this mop-up round that is going to be finished on 26th of May. So you can understand from 22nd of April there is a 26th of May, there is a huge gap. So earlier also we have uploaded the schedule that is expected to have, and you can check the earlier videos also, and the range till when you can expect a clinical seat, that we have already uploaded. So you can check the links in the videos, and you can visit the channel and you can find those videos that you can check it out. The important thing is that the question that arises, when it is going to have DNB counseling. So this is one important facet that is remain unanswered, because many person will go for the DNB counseling also. This is important thing. Number two, another important facet that we have to focus on, the private medical college counseling. The impact of private medical college counseling, ideally it should have been broadcasted publicly, and the counseling results should have been given in a central counseling, with a central counseling board, that should have been highlighted to everyone, but that is not going to take place in that particular manner this year. But we obviously have told and highlighted few things earlier also, why people are opting for the clinical subjects. What are the reasons? We already have uploaded in the earlier videos. And how, till what rank you are expected to get clinical seats, that is also being highlighted in the earlier videos. Please check that out if you want to see it. It is immaterial and not judicious to repeat all the information in this video also, because we have already uploaded that, and you can jolly well go and check those videos. That is in the for public viewership only. So you can check the video. The important facets which you should keep track, because many of the people who are qualified will get a seat maybe in the pre-para, but you have a pretty good, even if with a rank of 50,000 or 60,000, you might get a very good pre-clinical or paraclinical seat. But many are hesitant to join those pre and paraclinical seat. Apart from pathology, the pre-para clinical seat won't give you much financial return either. So that is a fox pass after a decade plus that you will spend for till your post-graduation degree. So that is one important issue, and nobody can write it off. You were the most brilliant of the batches, and after doing that, if you are not doing a clinical seats and you are losing that clinical touch, your relatives are not going to be satisfied ever and won't understand. Even if they do understand, they will not take it that you are not treating a patient. So this is the important facets. And your satisfaction also, you are not healing a person with a diseased person, and after losing the touch of the clinical side, after 3-4 years, it is going to be very, very difficult to see a patient who is going to have a shock case or an accident case, and you will feel nervous to treat that particular condition. Or a burn case, it will be very, very difficult, or a poisoning case even, which are very, very common. So these are the things which will come, but you have to be very realistic, and we have uploaded all the details in the earlier videos also. If you feel like, you can go and check that. And here important things that you must take it very, very serious note of, that you have to ask yourself that if you are willing to go for the next year or not. If you are willing to go for the next year, remember one thing: already 70 days already 70 days almost of 2020 is not there anymore. So 2020 at this point of time is barely 295 days from today onwards. So it is not even 365 days are left. So this is one important thing you should keep in your mind. And also the summer season examinations, the notifications are out. It is going to start from the May 3rd with AIMS, and then there will be 17th is going to be GPMR, and 24th is going to be PGI. So, and before that there is an immense examination. So these are the examination. If you are sincere to willing to go for the next year, you might sit for or appear for these examinations. And if not, within 6 months again you will have to write the examination. And 1st November you can check it out. 1st November is going to be winter PGI. They have already declared the date, so check that too. So these are the important informations that we have given. So you have to take a call whether you are satisfied with your clinical seats or not, whether the pre-para subjects, which is a COUNSELLING subject, you will get most probably you will get a job of that particular senior resident, assistant professor, associate professor way, and that is the remuneration is going to range between 1 to 2 lakhs. Even in the central institute, your salary is very highly unlikely to go up more than 2 lakhs. Whereas clinician, even if he sees 10 patients per day, can expect with a clinically skilled medical practitioner, he can expect around 3 to 4 lakhs, and that is the reality. If you are not in consonant with this particular data, check with your senior or the people you have who have passed from your family. I think you will find in go with the information that I have shared with you, and most importantly, you will have a clinical satisfaction. So if you are going for the next year, get into somewhere where you can you feel that you will be guided properly, because next year the examination is going to be very fierce. Next year it is there will be NEET PG, but the format of the questions are obviously different right now. The format of NEET PG is going to be more clinically oriented. So even from the pre or paraclinical subjects, if you gone by the MCI brochure that have been given, released already, the 10% are going to be from the basic subjects, and that also will have a clinical orientation. A similar pattern is already have been visible in the Central Institute examination. So much more emphasis in the due course of examinations are going to be from clinical subjects. The medicine, surgery, gynae are going to remain the most important subjects, and there will be 10% questions are from the pre-para subject, and which are going to be have clinically related, and 10% subjects are going to be from PSM, as because it is very important for the government that doctors should know PSM, because the national health programs and all, which are very important from the way the government medical services are played out. So these are going to be very important, and that is why PSM is going to comprise 10% of the MCQ questions, and that might have a clinical orientation also, that we all know. National programs are going to be very important in all the examination, the Central Institute examination, and also all NEET or next one examination. These are going to be very important. So hopefully this particular video is going to help you, because to help you to chalk out your path, and you can understand, you will have a time if you can pay the things, and you will have your time and chances to get a clinical seat even in the latter ranks that you are aware of. We have already uploaded the videos, and you can check them out for if you feel that the data are going to be helpful for you. So you can check them out, and strongly suggest, if you have chances and if you can afford, go for a private medical college if you feel like, and because you are also going to save your bond period timings. In the private medical college you will not have any bond period, and you directly can go after from there for doing your SS courses. Like, it's a pretty clear thing that a person who is doing a pre or para subject, and even in the central government institute, the pay is the remuneration is going to be at max as a assistant professor or associate professor. Even in AIMS or Central Institute, it is maximum going to be 2 to 2.5 lakhs. It's a professor range salary that you will get. And that is the highest one can hope for, because in a private medical college you will not get that much. And most importantly, you will have a doctor prefix, but you won't be known as a doctor anymore. But in a clinical subject, as we have already said, with a mere MD degree, and if you have a clinical acumen, and you go to a second or third tier cities, you can jolly well earn 3 to 4 lakhs. It will be strenuous, it's not easy, but you will earn that much money. So this is the sort of thing, because these are the information which are very important for people who have to earn their own food, and to fulfill their own dreams. And those persons who it doesn't matter to them, they can decide whatever is fine for them. But wishing you all the very best, and at the end, wish you a very colorful, happy Holi. Have all the colors in your lives, and if you feel all the M Excellence videos are actually helpful for you, you can actually forward it to your peers or your juniors or anybody you know who are going to give the examinations in future also. And wish you all the very best. Thank you.